Hello and welcome to Pregnancy Info. Today we will discuss all about reasons or causes of infertility. First of all, we have to understand what is infertility. Infertility is when you have trouble getting pregnant or staying pregnant. Fertility problems can happen in women or men, and you can have many causes. Infertility is common. Some people have a hard time getting pregnant or staying pregnant. You are generally diagnosed with infertility if you don't get pregnant after 1 year or more of trying, or if you have multiple miscarriages. There are treatments for many kinds of infertility, and many people go on to have a healthy pregnancy and a child. What causes infertility? There are lots of possible causes of infertility. Seeing a doctor that specializes in infertility can help you figure out what's causing your infertility problem and find the best treatment for you. The first cause or reason is not enough info. That means you are not able to understand your ovulation day or know how to calculate your ovulation days, or what are the best things or tips to get pregnant. Another thing is that not trying long enough. The first thing to consider is how long have you been trying. It may feel like you have been trying forever, and maybe you have, but it's important to know that many couples won't conceive right away. About 80% of couples conceive after 6 months of trying. Approximately 90% will be pregnant after 12 months of trying to get pregnant. This assumes you have well-timed intercourse every month. No ovulation. Human conception requires an egg and sperm. If you're not ovulating, you won't be able to get pregnant. Anovulation is a common cause of female infertility, and it can be triggered by many conditions. Irregular periods. The average women's cycle is 28 days long, but anything within a few days of that can be considered normal, as long as those cycles are consistent. For example, a woman who has a 33-day cycle 1 month, a 31st-day cycle the next, and a 35-day cycle after that is probably having normal periods, but a woman whose cycles vary so greatly that she can't even begin to estimate when her period might arrive is experience irregular periods. This can be related to hormone issues or a polycystic ovarian syndrome. Both of these are contribute to infertility. Painful or heavy periods. Most women experience cramps with their periods, but painful periods that interfere with your daily life may be a symptom of endometriosis. No periods. It's not uncommon for women to have an off month here and there. Factors like stress or heavy workouts can cause your period to temporarily disappear, but if you have not had a period in months, it's time to get your fertility checkup. Age-related infertility. For women after age 35 and for men after age 40, it can take longer to get pregnant. Some women assume if they still get regular periods, their fertility is fine, but this isn't true. Age impacts egg quality as well as quantity. Also, if your partner is 5 or more years older than you are, this can further increase your risk of fertility problems after age 35. Signs of hormone fluctuations is women could indicate potential issues with fertility. Talk to your doctor if you experience the following: skin issues, reduced sex drive, facial hair growth, thinning hair, or weight gain. Your fallopian tubes are blocked, so sperms cannot get to your egg. It can be treated by laparoscopy, and doctor will cut the edges or the blocked tubes to make you fertile again. Poor egg quality. You may have regular periods, but if you have not egg of proper quality, then it cannot be fertilized, and so you cannot get pregnant. Shape of uterus. The shape of your uterus makes it hard for a fertilized egg to implant. If you are using heel, then there will be a change in the size and shape of cervix so that you cannot get pregnant or be fertile. So use the flat shoes to get pregnant. Uterine fibroids. These are the ejections under the lining of uterus or outer lining of uterus. It can make the hindrance for your pregnancy, and this will uneven the surface of inner lining of uterus, so implantation can be difficult, and if you get pregnant by chance, then there will be no much enough growth of your fetus. Overweight or underweight. If you are overweight, then you have to reduce the weight for getting pregnancy. And if you are underweight, mean you are under 35 kilograms, then you have to increase the weight because due to weakness in your body and the health problems, you cannot get problem. So this is also the cause of infertility. Untreated chlamydia or gonorrhea is also the problem which can cause infertility. Gonorrhea is the pus cell problem that can cause disturbance in your body and hormonal setup also. So it should be treated before getting pregnant. Chemotherapy or radiations. If you are taking some chemotherapy, then it will be difficult to get pregnant because the radiations and chemotherapy can change your body hormonal levels, so you can be infertile due to this cause. Exposure to environmental toxins. Lots of exposure to environmental toxins like lead or pesticides can cause to infertility, so you have to avoid these pesticides and lead ingredients. Excessive drugs or alcohol. If you are addict of alcohol or you are using excessive drugs that are inhibited, then you should avoid these. If you get pregnant by chance, then these drugs and alcohol can damage the brain growth of your baby and many more other complications too. If you are a chain smoker, then it can cause the infertility problem because there is injurious smoke which is not good for you and for your health. So for being pregnant, you have to quit smoking. Pelvic inflammatory disease. This is also called PID. In this problem, you have much more discharge problem and you have some fungal infection that cause your uterus health disturbed and it will be not more fertile. So this may also the cause of infertility. PCOS is one possible cause of an ovulation. In this problem, there are many cysts caused by some unknown reason. And for avoiding these cysts, you have to change your lifestyle, reduce your weight, and also eat the healthy ingredients. After overcoming this problem, you can be pregnant. Primary ovarian insufficiency. If your ovary is insufficient to produce quality eggs, then there will be problem with your pregnancy. So, to ensure pregnancy, you have the sufficient ovary that can lead to healthy eggs and healthy pregnancy, vice versa. Thyroid dysfunction. If thyroid gland is not working properly, then there will be change in your hormonal setup. So it may lead to infertility. So to get pregnant, you have to solve this problem. Also, other than that, there is another problem which is called hyperprolactinemia, which is harmful for you to get pregnant or it will cause infertility. You have to cope up for getting pregnancy. Excessive exercise. If you are doing too much workout and you do overwork or exercise which can cause harm to your uterus and there will be no house for pregnancy. You have to reduce the workout to make your body in the rest phase and if you want to conceive then you should have rest and simple walk and quit excessive exercises. Endometrium problem. Endometriosis is when endometrium-like tissue, which is the tissue that lines the uterus, grows in place outside of the uterus. It is estimated that up to 50% of women with endometriosis will have difficulty getting pregnant. The most common symptoms of endometriosis include painful periods and pelvic pain at time beside menstruation. Endometriosis is commonly misdiagnosed or simply just missed. Endometriosis cannot be diagnosed with a blood test or ultrasound. It requires diagnostic laparoscopic surgery. Depression is the cause of almost all diseases. If you are depressed or you have had many miscarriages or you are not getting pregnant for many years, then it can cause depression. And the depression makes your hormonal imbalance that you cannot get pregnant. So be calm and be positive to get pregnant. Autoimmune diseases. Autoimmune diseases like lupus is one of the cause of infertility. In this case, your immune system is going against your body and you will not get pregnant due to this problem. So you have to solve this problem to get pregnant. Sexually transmitted diseases. If your partner is suffering pus cells or dead cells, then you may also have sexual disease that can cause swelling in your uterus, and for that you will not get pregnant or you can face infertility. Diabetes is also one of the reasons of infertility. Due to diabetes, there is hormonal imbalance and you have to do much more to get pregnant. So be in consent with your doctor to get pregnant if you are diabetic. Unexplained infertility. Between 10% and 30% of infertile couples never find out why they can't get pregnant. Some doctors say this is the lack of good diagnosis. They say there is no such thing as unexplained infertility, but only undiscovered or undiagnosed problems. The fact remains, though, that some couples don't get answer. However, not having answers doesn't mean you cannot be treated. You can and should still receive treatment for infertility even if your diagnosis is unexplained. Pain during intercourse. Some women have experienced painful sex their entire life, so they have conceived themselves it's normal, but it's not. It could be related to hormone issues, to endometriosis, or the other underlying conditions that could also be contributing to infertility. When to call a doctor? Doctors recommend that you see a doctor about your fertility if you are 35 years or older and have been trying for at least 6 months, or you are younger than 35 and have been trying for at least 1 year. If either of these fit your situation, then see a doctor even if you have no symptoms of fertility problem. Other than all these reasons or causes, there is a key we have, which is prayer. More often do prayers and ask God for your help. You will definitely get a healthy baby because only of your prayers and faith in God. So if you like this video, then like it, share it with your family members and the females who are pregnant, and also subscribe my channel to encourage me. Thank you.